Hi from a lovely spring afternoon here in Dublin. I thought I'd answer one of the commonest queries we get on social media, which is about lines around the mouth. We call these perioral lines, and they're also called lipstick lines, smoker's lines, or barcode lines. Women tend to get them more than men because men's skin around here is thicker and it carries hair, and so that protects them a little bit. But as women, we're prone to developing them as time goes on, and also as we pick up some sun damage on our whole faces. The DNA damage that happens as a result of sun exposure thins the skin and it makes it a bit less elastic, like a pair of tracksuit bottoms where the knees get baggy. So that skin gets a bit less elastic. And then from repeated talking and sipping, we tend to get muscle activity that purses the lips, and the repetitive creasing tends to cause little lines in the skin. We get the same ones around our eyes, as those are muscles, again, like a purse string or a sphincter. They pull in, and the same happens here. We also lose fat around the mouth as time goes by, and the maxilla bone here and the mandible here are shrinking and changing, and so we're getting less support, and that terrain above the lip especially gets more prone to lines. What can you do about it? The first is really skincare, and that's using a good quality SPF every single day. Now, we've picked up a fair bit of our damage already by the age of 20, but any SPF after that is always very worthwhile, and I use SPF every single day, same as brushing my teeth. I keep my SPF on face, neck and hands in any exposed areas. Retinol is really good as well. That's vitamin A, and it's a product for nighttime use. You build it up gradually twice a week starting off, and then you ideally would be using that up to 4 or 5 nights a week. And you can use it for fine lines around here and here. I use mine a little bit on the eyelid, but I do thin it out a bit with moisturizer for those delicate areas, and always moisturize after your retinol. Then you can use vitamin C in the morning, which is an antioxidant skin product. It protects against sun damage a little bit, and it helps build collagen, and so it's a really useful product to add into your regime. So those 3 ingredients, retinol, SPF and vitamin C, are your core ingredients. If we look at things then that will help to improve the skin, you can do things like peels, and I've had an Obagi Blue Radiance peel a couple of days ago from Leah. I'm shedding a little bit on my chin, but that's fine. And peels can help to get rid of dead skin cells on the surface of the skin, and it can speed up that renewal process of skin cells and build collagen. So peels are a really good idea. They don't have to be aggressive. You can start gently and you can build up layers. And I had 3 layers the other day, and that was plenty for me. And then Leah didn't put a retinol on top of that because I've got a couple of events coming up next week, including a date, which is lovely. And so I don't want my skin to be peeling. One of the things I really like a lot is skin pen microneedling, and that helps to physically break up lines, and we use it on the whole face, and we go a lighter setting around the eyes and mouth, but we still will help to stimulate collagen and repair that area, and a course of treatment is needed. I'm not a great fan of home microneedling devices because they blunt easily, they're very hard to keep clean, and often you can't get deep enough to get the result that we would achieve in clinic. So ideally for something like that, go and see a medical practitioner and have a course of treatments in clinic. They're really well tolerated, and skin pen, I've tried many devices, that's my absolute favorite. You can do things as well, like put in a tiny amount of a very runny dermal filler or hyaluronic acid injectable product, and you can come in from the side here and here with a little blunt tool called a cannula, and I put a minuscule amount of product in that area, and I keep it very runny so it doesn't bulk out or give a shelf. We keep it really natural. I wait a few minutes and then I come back with a really tiny needle and refine any little lines or sharpen up the cupid's bow if I need to. You can also use a prescription-only medicine like botulinum toxin, and in Ireland it's only licensed to be prescribed and administered by a doctor or dentist. I had a little lip flip yesterday where a colleague did some toxin close to the edge of the lip and on top of the cupid's bow, and over a few days it will turn out the lip a little bit and give me a bit more pink show or pink of the lip, and it'll reduce some of the little fine lines. I got a small bruise yesterday from the treatment. I think I have another little one here. I tend to bruise easily, so it's not my colleague, it's just myself. So if people ask me, we always say, do expect bruising from any procedure. The face is full of little blood vessels. So a tiny bit of toxin here can be really good, and that can reduce fine lines. Dermal filler, absolutely as well, but it has to be an incredibly delicate, runny product so it's not too thick. The other thing you can do are laser and light treatments. And we know IPL, or our version of it, is the Cyton BBL. That treatment can help reduce fine lines and tighten the skin. And you can go on to another treatment called Moxie, which is a fractional laser treatment where we target little tiny dots or little columns of tissue under the skin, and we're causing tightening and repair, and that's really good for fine lines. If you think of more aggressive facial peels, these we don't do as much as they were done in the previous decade because they are very strong, and with our Celtic skin we like to just go gently, start with the simplest things that you can do and build up if you need to. You can also use polynucleotides, which are little tiny DNA building blocks extracted from salmon or trout DNA, and they help the cells to behave younger, and they can work really well to regenerate the area. But when lines are etched in, we need often a combination treatment. So there isn't a single skincare ingredient or a single treatment that's going to just make that terrain completely smooth. So often it's a couple of little things in conjunction to get the best result. I hope that's helpful, and feel free to get in touch if you've any queries. Take care. Bye.